Hello, my lovely people. Thank you so much for clicking on my channel once again. Today we are going to talk about oral thrush among babies. Anybody can get oral thrush, but we are talking about babies because that is our focus on this channel, babies and children. So what is oral thrush? Oral thrush is a fungal infection. So it's an infection caused by the fungus and it's in the mouth of babies. That is why we call it oral. Oral means mouth. So when your baby has oral thrush, what you will see is that there is this white thing in the mouth, on the gum, or on the tongue of the baby. Sometimes you can actually see it deep within the mouth, that is getting into the throat of the baby. It is white, it is like milk, but it is not milk. The difference between it and milk that is stuck to the baby's tongue or gum is that for the milk, when you wipe it, you use a wet towel and wipe it, it just goes away. But for oral thrush, when you clean it, it doesn't go away. And if it goes away, where it was, the place will bleed. That is oral thrush. So it's this whitish thing that gets stuck on the tongue, on the roof of the mouth, on the gums, and in the lips of babies, the inner side of the lips of babies. The fungus that causes oral thrush is Candida. We all have Candida on our skin, and it doesn't cause problems all the time, or most of the time it doesn't cause problems. So why may Candida affect the mouth of some babies? The first thing, and that's the most important, is that the immune system of babies is not well developed. Just because they are babies, their bodies are not yet strong to fight infection, so they tend to get oral thrush easily. And then, I said that Candida is on everybody's skin, including babies, but there is a balance and it doesn't cause any problem. So sometimes we disturb that balance and then the Candida begins to cause problems. How do we disturb that balance? One of the ways we do it is antibiotics. So sometimes you find that oral thrush comes into the mouth of your baby after your baby has had a course of antibiotics. That means that when antibiotics are not necessary, your child or your baby should not get antibiotics. Commonly, we find parents buying antibiotics. For every little cough and cold, they buy antibiotics. It's not good. It can give your baby thrush, so don't do it. Let the doctor see. And of course, if the antibiotic is necessary, it must be given to your baby. But I'm talking about situations where it may not be necessary because the doctor has not seen your baby, your child. So don't do that one. Another situation that can make babies more prone to oral thrush is immune deficiency. So this is different from the normal underdeveloped immunity of babies. Immune deficiency happens in some children because they have some diseases already. So a baby may have, say, type 1 diabetes, but a lot of babies who don't have any disease already will get oral thrush just because they are babies and maybe they've had antibiotic use, then they get oral thrush. Some babies may also get oral thrush when they have thrush in the diaper. So sometimes babies get diaper rash and then thrush comes there and adds onto the diaper rash. So you think that is just a diaper rash, but maybe it's also an added fungal infection on top of the diaper rash, and then such babies can get oral thrush because it's the same thing causing that rash that is also causing the oral thrush. And then sometimes the oral thrush is from the mother. It may be on the mother's nipples. So if you are breastfeeding and you find that your nipples are cracked, but there is this deep pain within your nipple even after you have stopped breastfeeding, that may be nipple candidiasis or fungal infection of your nipple, and then you can give it to your baby during breastfeeding. Sometimes actually it's the babies that give it to their moms during breastfeeding. When the nipples are already cracked and your baby has oral thrush, then the baby may pass it to you during breastfeeding. So it's a job hazard of breastfeeding, but what can we do about it? So some babies develop oral thrush and it will go away on its own because the body is able to fight it. But some babies will get oral thrush and it won't go away. Like I said, they may pass it on to the mother. They may then tend to get oral thrush on top of their diaper rash. And then the oral thrush may go down into the pipe where we swallow, where we call the esophagus. The oral thrush may go there. And when that happens, you will find that, or when the oral thrush is so bad, you will find that your baby doesn't want to feed. Your baby is crying whenever you try to breastfeed. When you give something to your baby, she won't swallow, she will drool, it will stay in the mouth and then just start coming out of the mouth like saliva. So that is when oral thrush becomes a problem. You need to take your baby to the doctor to take care of it for you, or to see and decide what to do. If it's just a tiny bit and there's no problem, your doctor may decide to just watch it. But once it becomes serious, or once you, the mom, have it from the baby, then the doctor will decide to treat it for you. And treating it is usually very simple. So when you find this, just take your baby to the hospital or the clinic, and then it will be sorted out for you. Most of the time, if baby has it and mom has it, then both of them need to be treated so that they each do not get it back. Yeah, that's how it is. So this is oral thrush, and it's quite common among babies, and this is what you can do about it, and the things that you can do to help your baby not to get oral thrush. If you have any questions or comments, please put them in the comment section for me. And if you have not yet subscribed to this channel, kindly subscribe, because we talk about everything and anything that has to do with your baby. We also have a blog. It's called babychild.co.com. You can go to our blog and we have a lot of useful articles for you to help you parenting your baby. And in addition to that, you can join our parenting club, which is our subscription. We will give you personalized guidance every week until your baby is 2 years old. Thank you so much for watching. Bye.